So let's go ahead and introduce our guests. So first of all, we've got Shamari Scott, who is the Chief Business Officer. He's no stranger to the program. Good morning, Mr. Shamari.
Good morning, Sandy. How are you?
I'm good. I see you're in a slightly different spot this morning.
Yes, I am. Yes, I am.
We pay attention to these things.
Yes, yes. Very observant. Very observant.
Yes,
And good morning,
absolutely.
Cayman Islands.
Good morning. And we have Dr. Susant Kumar Buyan, neurologist. Hopefully, I've gotten that correct. Good morning, sir.
Good morning. Good morning, Sandra.
So good
How
to
are
have
you?
you on the program. I believe this is actually your first time.
Yes, I'm pretty new to Cayman, not even a week old now.
Wow. So special welcome
So
to you.
uh, it's a new experience for me. Beautiful island you have, lovely people. I'm really impressed within the first week that I've been here.
Yes. Well, welcome. Welcome. So good to have you here. And we also have Dr. Ramneesh D'Souza, who's an interventional neurologist. And of course, I think Dr. Ramneesh, this might be your first time as well, but you're no stranger. I know you. So good morning to you.
Morning, Chandra. It's actually my second time
That's
on
your
your
second
show.
time.
It's
Okay.
my second time, yeah.
All right, beautiful. I'll be coming part of the CMR family for sure. And
Yeah.
we've also got Ali, this is Allison. Oh gosh, Ali, this last name. Is it Alaru from the Cayman Heart Fund?
Alari. Ali
Alaru.
Alari.
Ooh,
Hi, yeah, from Cayman Heart Fund. Hi, morning, Sandy.
yeah, I knew I was going to butcher that one. So good to have you with us, Ali. So good morning to everyone. All of our usual suspects are here waiting to hear all about strokes. So this is a super interesting conversation because topic, I should say, because really and truly, this is something that I think we all know someone who's had a stroke. Hopefully they've recovered. And then there's some people who don't recover. In fact, just last week, I was reading this celebrity, what's his name now? Jamie Foxx. Is that his
Right.
name?
Yes.
He's had a bit of an unusual stroke. I was reading or listening to a YouTube video about this specific type of stroke that he's had. So we'll get into some of that because I see that the one that he's had is actually on your list. So very, very interesting. So first of all, give us an idea. What is a stroke? I mean, we hear it and we kind of think we know what it is, but what is it?
Okay, so stroke is also called as a brain attack. It occurs when there's a compromise to the blood flow to the brain. Basically, there are two types of strokes. One is known as ischemic, the other is known as hemorrhagic. Ischemic, which is the more common type of stroke, is where there's a blockage to the blood vessel. And hemorrhagic, which is not so common, it comprises about 20% of strokes, occurs due to rupture of a blood vessel, thereby leading to bleeding within the brain.
Wow. How common are strokes? Like, what are we looking at in terms of general population?
Strokes are relatively, it is the leading cause of one of the leading causes of morbidity and mortality. If you look at it, as you age, the incidence of stroke goes up. So we are seeing more and more strokes in younger people as well. This is basically due to lifestyle, etc., where younger people are having strokes.
Wow. And of course, we're going to talk about some of those factors here in just a second. And they're also different. You already mentioned some of the different types of strokes, but I mean, I find this so interesting, really and truly, because like I said, I feel like we all have had someone in our lives who've been impacted by this. So of course, let me just remind our listeners, 936-2626 is the telephone number. If you guys have any questions, you can feel free to call in at any time. So let us first talk about the different types.
Sandy, not to cut you, but just before, I didn't come on the program previously with Dr. Ramneesh, so that would have been, he would have been on the program without me. So I just want to make sure that, and I want to make Dr. Ramneesh blush. And just give an overview of who Dr. Ramneesh is. He's been with us. He probably was the second wave of physicians we had when we realized all of the gaps that existed outside of cardiac care, outside of orthopedics, outside of pulmonology. And we understood that from a neurology perspective and an interventional neurology perspective, there was a major gap, both here in the Caribbean as well as here on island. And that's why we brought in Dr. Ramneesh, who has over a decade of experience interventional neurology, and at some point in time, he'll need to tell us how he's able to actually go in minimally invasively and extract clots when it comes to a stroke. So we'll get there as well. But interventional neurology, treatment of acute ischemic stroke, ischemic stroke, neuromuscular disorders, and neurocritical care are some of his areas of expertise. He's involved in over 1,000 neurointerventional and diagnostic procedures, such as carotid artery stenting, coiling for intracranial aneurysms, and spinal vascular malformations, endovascular treatment in acute ischemic stroke as well. Has had numerous publications, both nationally in India as well as in international journals. And because we want to fulfill and ensure that we have a holistic team when it comes from a neurosciences perspective, which we started many, many years ago, we now have Dr. Susant, which is, our pleasure, Sandy, that one of the first places that he's actually visiting from a public perspective would be CMR.
Yeah.
And he's coming in as a senior consultant as well, has over a decade of experience. And as you know, Sandy, we always bring the A team. So he's coming from a JCI accredited institution. It's been ranked in the top 10 in India year after year after year. And he also has been in numerous publications and has had numerous speaking engagements. And Dr. Ramnish and Dr. Susant will be able to speak to the neurosciences team and how Dr. Susant is coming in to be able to ensure that we're covering all gaps when it comes to the neurosciences. And we're just very, very pleased to be able to build that team further to the benefit of the Cayman Islands.
Well, thank you so much for that beautiful introduction. And I want to say too, in line with that, anyone who's listening to the program, sometimes you might see guests here. Perhaps you make an appointment to go in and see one of the specialists at Health City. I do want to remind you that you can always go to their website. They have a very, very comprehensive website, and you can look up the specific physician perhaps that you have an appointment with, and you can see the years of experience that they have, the number of procedures that they've done. I was just looking here, Shamari, at the Health City website. I want to remind people what a wonderful resource this is, so that you can all certainly take advantage of it. Let me just show you see, you go here, you can look at Dr. Ramnish and others, and it'll tell you all about, number of procedures performed, 700 plus, what his qualifications are, title or specialty, background. They've got professional highlights. Oh, Dr. Ramnish, it's a long list. Education and fellowship, special areas of interest, and then procedures as well performed. So 700 plus, I'm sure that's gone up probably since
we put that on, definitely. And what's exciting, Sandy, is within the month we'll have our new website that we'll be able to actually show you that as well. So we've had this website for a while. It's done its job, and we're going to have our new website with all the bells and whistles coming within the month. And you were also mentioning how you can get through to our physicians. You can also download the Connect app on the Apple Store. And you can actually live book your appointments with any of your physicians at both the East End and Camana Bay locations by going on the Connect app as well. So that's another way that you can actually reach out to Health City.
Absolutely wonderful. All right, very good. So is Dr. Susant already on the website? I don't know if you guys might have added him.
Dr. Susant is not on the website just as yet. He's only been here for a week.
Yes.
So we'll just have a few more days, and then he'll be up in there in all of his glory.
All right, being worked on. All right, so folks, again, good morning to Miss Charlene, Marshall, Lizette, Olivia. Everybody's here this morning, usual suspects, of course, and all of our radio listeners who sit back and silently listen, as they always tell me. We're talking about strokes this morning, an extremely important topic. We know that, as Dr. Ramnish has said, the prevalence of strokes means that we probably all have, known someone in our lifetime who has had to deal with one of these. So let's talk now about the different types of strokes that exist. So tell us a little bit about these two types here, doctors.
Dr. Susant, you want?
Yeah, so the stroke, like we had already discussed, is something which happens suddenly. It's like a lightning out of the blue. Suddenly, you are one moment you are absolutely correct, righty, and next moment you can't either speak or can't move your limbs. So the two major types of stroke that we experience is one is called an ischemic stroke and another is a hemorrhagic stroke. Basically, the end that the body experiences is the same in both the different types of stroke, but the ischemic stroke is more common. Here, what happens is the clot blocks a blood vessel, which stops the blood supply to the brain. As a result, the brain tissue rapidly undergo damage. While in a hemorrhagic stroke, one of the blood vessels bursts, so the blood is released to the brain tissue, causing damage. Both of them can be catastrophic. Ischemic stroke has treatment of ischemic stroke has evolved rapidly. Now we have a lot of treatment options within the first 4 to 24 hours where we can reverse the effects of the clot. We have medical therapy as well as interventional therapy to address ischemic stroke, which is by far the most common type.
All right, very good. And when we talk about some of the different types of strokes, we know that there's some risk factors that physicians can really point to. So let's talk about what some of those are.
So if we look at the risk factors, they can be like into two groups. One is modifiable, one is non-modifiable. Like some factors we cannot control, like age, race, or different other factors which are within our genetic buildup. The other factors that we should concentrate are modifiable or which we can control. The major risk factors are like which are controllable are diabetes, hypertension, cholesterol levels. If you have any of this, then you should have a strict control because on the long term, these are major contributing factors which lead to a person developing stroke. Now, certain lifestyle issues like smoking, which are major risk factors, if you have this as one of, along with other risk factors, you should give up smoking. Strongly suggested. Alcohol in moderation, is also in large amounts is a big risk factors. Weight, obesity is a risk factors which can be modified. So we should work on things that we can control, like our diabetes and hypertension, and we have a strict control. And if you have any symptoms, it becomes very imperative that we have a good control on these modifiable risk factors.
It seems like there's quite a bit here in terms of risk factors that we can do something about.
Yeah. So these things we can do on a regular follow-up with the physicians, do our blood sugar test, monitor our blood pressures levels, cholesterol levels, and these can go in long way in preventing catastrophic stroke attacks, which can be make our life very really dependent on others, and which can be a big burden both socially as well as emotionally to the family members.
Would you have a question from one of our listeners, Alejandro? Good morning. Alejandro says, my mom had a stroke and was bedridden for about 3 years and developed sepsis before she passed away. How does that happen?
So that basically happens because the patient is bedridden. They are prone to respiratory to infections of the lung. What happens is you do also have cases where you have what is known as microaspiration. So normally how we would swallow our saliva, this does not happen in a patient who's had a stroke. It may be entering their lungs instead. These conditions can lead to sepsis. Also, because of the patient being bedridden, they are prone to bed sores, which are basically because of lying in the same position for a long time. The skin gets damaged, leading to infections, which again can lead to sepsis. Not particularly sure what kind of sepsis, particularly in this case, but yes, patients who have major strokes and are bedridden are prone to sepsis.
Just unfortunately, one of the downsides, right, of being bedridden.
Yes.
Everton, good morning to you. We have Erica who says Health City is a wonderful facility with brilliant doctors. Ms. Sue agrees with that. She says Health City, great hospital. Bishop Blair, good morning to you. Bishop says, what a beautiful day to be alive. The Cayman Islands has been blessed with all of these providers available at Health City. Good job, Sandy. Good morning to Miss Barbara. Good morning to Mr. Amelia here, giving thanks as always. And Alejandro, thanks you for that answer. So we mentioned those two types of strokes, but there are actually a few other types as well. Can we go ahead and talk a little bit about those?
Sure. So those would be more in the hemorrhagic stroke category. Hemorrhagic stroke, as Dr. Sushant had said, is when a blood vessel ruptures. The most common cause of a hemorrhagic stroke is uncontrolled blood pressure, but there are other types of hemorrhagic strokes. This is what we call as a subarachnoid hemorrhage. These are usually secondary to aneurysms or weakening in the blood vessel wall. Other conditions which can cause bleeding is what is known as AVMs, an abnormality within the vasculature of the brain, which again leads to bleeding within the brain. So even though hemorrhagic strokes do contribute for just 20% of strokes, they need to be thoroughly evaluated before they just said that they are hypertensive. We need to rule out other causes for the bleed or the hemorrhagic stroke.
Wow. And you mentioned uncontrolled blood pressure. Of course, this is when we talk about some of the potential, risk factors. This is definitely at the top of the list. It's called a silent killer, I suppose, for a reason, because you can have high blood pressure and there can be zero signs that you have it.
Absolutely.
That's pretty scary.
Yeah.
Yeah. So is there certain, because you mentioned that more and more individuals at a younger age are now having strokes. That it used to be that it was kind of associated with being a senior, and that's no longer the case. So what's happening in our general population that is causing the increase in younger people to have strokes?
So this again goes back to the modifiable risk factors Dr. Sushant spoke about. So lifestyle is playing a major role, not just with stroke, but even coronary heart disease or heart attacks. So when I say lifestyle, it means obesity, the excessive consumption of alcohol, smoking, not looking after risk factors like high blood pressure, diabetes, and all of this, if managed properly, can prevent not just strokes, but any vascular event from taking place.
I'd just like to add in,
yes,
the major one what I feel is that present lifestyle, the stress that we are exposing our body to in the day-to-day life, both physically and mentally, I think it's a big factor contributing not only to stroke, other diseases like cardiac conditions and all. So stress, I believe, is a major silent factor which is underplaying in all the medical conditions, aggravating at a much younger age, that we are seeing today.
Okay. All right. Very, very good. So we've talked about some of the risk factors, folks. Again, if you have any questions, don't hesitate to call in. This is your opportunity to speak directly with the experts this morning. What symptoms are we looking at? So how does someone know that they're actually having a stroke? And I know that strokes can present themselves in slightly different ways. My cousin that I was talking about, who recently was at your facility after having had a stroke, she said that she wasn't the one who actually realized that she was having a stroke, which is so interesting because, you kind of think you'd know if you were having one, but apparently not. But there could be some symptoms that you might notice.
Yes. So the easiest way to recognize symptoms of a stroke is any onset of any new symptoms, which could be sudden onset of numbness or weakness of one side of the body, difficulty in speech, word finding difficulty, double vision, blurring of vision, difficulty in walking. So these are the symptoms. So any onset of any new neurological symptoms should be considered for a stroke. The best way to remember this is the acronym BFAST, where the letter B stands for balance, E stands for eyes, F stands for face, A for arms, S for speech, and T for time to call 911. So what that basically means is if you have an acute onset of difficulty in maintaining balance or walking, if you develop any kind of new eye symptoms, that could be loss of vision in an eye, double vision, blurring of vision. If you notice that someone's face has become droopy to one side, if you ask them to hold out their arms and they're not able to hold it out straight and one arm tends to drop, And finally, speech, again, slurring of speech, inability to speak, inability to understand what is told to the patient. Then it comes to T, which is time to call 911 or get to the nearest hospital as soon as possible.
Yes, indeed. I was kind of just checking with her to see if she might have been listening to the program this morning, because in her case, she actually went, I can't remember exactly what she said was going on, but again, she didn't pick it up, and she went to physician, and when they saw what was going on with her, I think it was something actually related to her vision, but again, she didn't associate it with anything being that serious. They said, we need to get you to emergency care right away. And of course, they sent her to Health City. So pretty scary stuff. But the earlier you can recognize the symptoms and get treatment, the better. I think there's a recovery rate if you can get to the facility within the first hour. That is amazing. Is that correct?
So that is true. The sooner we intervene, the better it is. The less neurons which will get damaged. Stroke treatment has undergone a major revolution. Till about 1996, there was no actual treatment for these kind of ischemic strokes. They then came out with a treatment known as a clot buster. This was given intravenously in patients who presented within 3 to 4.5 hours of the symptoms of stroke. Lately, there has been an evolution not only in the treatment, but also in selecting patients who can undergo what is known as endovascular treatment. Endovascular treatment is where we access the vessel which is blocked through a minimally invasive procedure. We access the vessel and we recanalize that blood vessel, restoring flow to the damaged area of the brain. Initially, the window period for this was 6 hours. Gradually, it has increased now up to 24 hours. We also have now software which helps us select patients who reach late, who may still benefit from this endovascular treatment.
Wow. All right. So it's good to hear that there are now some treatments available. So the most important thing, of course, here we see is trying to restore blood flow to the brain as quickly as possible.
Yes. Yeah.
And what sort of medications are normally prescribed for individuals who've had a stroke?
So in the acute phase, if the patient reaches us within the window period of 3 to 4.5 hours, we give a clot buster known as a tissue plasminogen activator. This is given intravenously. Some institutes also use a medication known as tenecteplase, which is also a clot buster to dissolve the clot. Patients coming after 4.5 hours, they are the ones who would be considered for endovascular treatment. So again, as I said, we go into the blood vessel which is blocked, try to recanalize it. Sometimes we administer the clot buster directly into the vessel which is blocked as well, rather than giving it intravenously, just to improve the perfusion.
Okay. We do have Ali who's here from the Cayman Heart Fund. Good morning, Ali. I know that the role that your organization plays in heart health, which is also part of, strokes and not just heart attacks, but, they kind of go together in a lot of instances, is such an important role. You guys have educated a lot of the community here about trying to make sure that they know what their risk factors are and trying to mitigate those risk factors as much as possible. Can you tell us a little bit, maybe some people have not heard of the Cayman Heart Fund, exactly what it is that you guys do and a bit about your organization?
Yeah, sure, Sandy. I'm sure there's a lot of people listening that are wondering why the Cayman Heart Fund are here talking about stroke, but we're the national cardiovascular charity. So stroke is a cardiovascular condition, much the same as heart disease. So we support people in the community with stroke, just as we do with heart conditions. And I'm really grateful to Health City to inviting me on the show this morning to make people aware of that, because I think a lot of people aren't. The Heart Fund as a charity has 3 tenets: educate, influence, and support. So, for example, this morning, educating people about their risk factors, because what we'd like to do is prevent strokes from taking place in the first instance. So if people know their numbers, if they know whether they've got high blood pressure or some of the risk factors, they're less likely, they can modify those lifestyle factors, and they're less likely to suffer the effects of stroke. So we would encourage people to see their physicians if they can, and be aware of their health, and be able to take steps so that they don't have stroke. Obviously, insurance is a part of that, the ability to see a physician. So the Heart Fund is here. We do free health screenings in the community. So if people follow us on social media, they'll find out when our next health checks are, and they can come along and get checked for their blood pressure, get their blood tested, and know those numbers. And any other health screenings take place by lots of organizations on Ireland, like Rotary, and we would publicize that on our social media as well. So education is a huge part of what we do, obviously influencing policy changes to try and keep the nation healthy. And we also have support systems there as well. So if people in the community have suffered stroke, they can contact us for assistance.
All right, we do have a caller who's joining the program. Good morning, caller, and welcome to the Cold Hard Truth and Tuesday's Medical Rundown. Hello? I just plugged it back in. Give me 1 second here, caller. Let me try that again. See if we can pick you up. Morning, caller.
Morning.
Yeah, there you go. Yes, good morning.
Okay. Morning. Along the lines of, or I should say, in the interest of seeking practical comprehension about prevention, one of your guests used the phrase excessive alcohol. I wonder if he could parse that language a little more for the public. What I get when I hear him say that is excessive sugar in any form, not just alcohol.
Okay.
Question.
Yes, thank you, caller. All right. So excessive alcohol, the caller is saying if you could probably give that, define that a little bit more in terms of what that is. And is it the alcohol, or is it the actual sugar and the alcohol that is really the problem?
It would be both of them. So when you refer to excessive alcohol, the easiest thing to follow is no more than 10 drinks in a week and no more than 4 drinks in one session of drinking. That you should not exceed those numbers.
And a session of drinking shouldn't be every day.
Exactly. So that's why 10 drinks in a week. 10 drinks in a week and or no more than 4 drinks. We've all seen those pictures of the glass wine, which gets bigger and bigger.
Yes.
Yes.
Yeah, there's one that's floating around on social media at the moment.
Exactly. Yeah.
It says that my husband or my doctor, the kind of changes, says I must only have 1 glass of wine a day or whatever. But they pour out the bottle and the glass is like the entire bottle. So
exactly.
That's still excessive.
Yes.
Ali, thank you so much for telling us a bit about what the Cayman Heart Fund does. I had the opportunity, I think it might have been, oh gosh, was that last year already? Time flies so quickly, to attend your annual fundraising luncheon. And it was really, really amazing to see people there who have been impacted by, heart attacks and strokes. And there were some people who were young, and I looked at them and I thought, how on earth is this possible? But of course, they might have had some risk factors that they were potentially ignoring and just didn't know anything about. There was the one young lady in particular, Darlene, I think is her name.
Daphne.
Daphne, sorry. Daphne. Yeah. And I mean, I look at her, she's a young mom, she looks vibrant. And I was a bit surprised to hear that she had, was it an actual stroke in her case?
Yeah, she's one of our stroke survivors. So the Heart Fund recognizes every year or every other year, partly because of COVID, we've not done it every year for the last few years, our heart heroes and our stroke survivors. And those people play a really important role in educating the community and how to look out for the signs, because I think using real experiences of real people who've suffered these conditions can be a great educational tool and a great wake-up call for people that it can happen to everyone, to anyone. And like you said, blood pressure is the silent killer. You could almost use that description for heart attack and stroke as well. Is it really comes out of the blue. It's not like going and getting a diagnosis and knowing that you've got a long journey ahead of you towards an end path. It very much comes out of the blue. So having those stories, sharing those stories of survivors, and Health City does a really good job of it as well. You know, I've seen their testimonials on their website and Facebook pages of people who've survived. And the Heart Fund's always looking for people to be nominated as heart heroes and stroke survivors. So if you know somebody that you think would be willing to share their story, we would love to hear from them.
Yes. And what struck me about her in particular, again, her youthfulness, but she talked about, you know, that there were signs, I think over a couple of days, that she had signs of pain, that she was kind of like, oh, you know, maybe it's nothing serious. And it's
a neck pain, or it's a, I think that's the most important thing is sometimes, and women are guilty of this more than anything. We lead busy lives and we're always trying to take care of everyone else. We can sometimes ignore those symptoms and think, I'm just tired, I'm just exhausted, I need to lie down. And honestly, that's almost the worst thing that you can do. And I'm not a medical professional, so I'm not going to speak out of place, but you know, seek help from a physician, get an opinion, because those symptoms, they might seem innocuous, but they are actually quite serious.
Yes.
No, that is what we call as a mini stroke or transient ischemic attacks. These are basically warning signs that a stroke you're in danger of having a major stroke. People need to recognize those symptoms. They need to seek care as soon as possible. So those symptoms would be similar to a stroke, like you'll suddenly one side of your body will go numb for a couple of seconds, it'll then recover. You may find it difficult to speak for a couple of seconds and then recover. So these are known as transient ischemic attacks, and these are warning signs that a major stroke may follow soon.
Wow. Okay, we've got Priscilla with a question. Priscilla says, after a stroke, what is the best way to prevent micro aspiration in a bedridden patient or bedridden person?
So every patient who's had a stroke will undergo what is known as a swallow assessment. The swallow assessment is to see that the patient is able to swallow food, swallow their own saliva. If the patient is having difficulty in swallowing food, a procedure known as a PEG tube may be advised, wherein a small feeding tube is placed directly into the stomach. If there is a suspicion that the patient is having microaspiration, the patient may be even advised to undergo what is known as a tracheostomy to secure the patient's airway and prevent this kind of microaspiration.
All right, very good. Okay, so folks, again, the lines are open, 936-2626. If you have a question, you can certainly send it on WhatsApp as well as in the chat. I know some people are a little bit more shy about these things, but there's no need to be. Of course, reducing your risk, now that we know what the risk factors are, reducing your risk should be pretty straightforward. So here are some of the things that you need to do. So being physically active, limiting your alcohol consumption, avoiding smoking, choosing a low-fat, high-fiber diet with lots of fresh fruits, vegetables, and whole greens. Limit your salt intake to about 1 teaspoon daily, and manage any underlying conditions that may increase your risk of a stroke. Any examples that you can give us for underlying conditions that may increase your risk of a stroke?
Sorry, go ahead.
That would be your diabetes or your hypertension, your cholesterol levels, any cardiac conditions, especially any disease of the cardiac valves, or in the disease in the cardiac rhythm where the heartbeat is not regular, it's beating fast at times, it's slow at times. These give rise to clots in patients, and which can migrate to the brain and cause stroke. So all this disease should be managed medically by these specialties. You can consult an endocrinologist or a cardiologist if you have an underlying condition like this, and take proper medications for this. Because if these are in check, the chances of stroke happening are reduced quite significantly.
And we want to remind people that obviously death is one of the things that can happen as a result of stroke, but a lot of stroke victims may not die. They may have other debilitating, symptoms. And there is recovery as well for a lot of stroke victims. So let's talk about some of the effects of actually having a stroke.
So again, it depends on which part of the brain is affected.
Yes.
Whether it is your speech area, whether it is your motor area, it comes down to which part is affected. There is recovery after stroke. So, and the maximum recovery occurs in the first 3 months following a stroke. which is why it is very important that the patient undergoes a vigorous physiotherapy and rehabilitation program, speech therapy and occupational therapy as well.
Mm-hmm. And Ali, your organization offers support for stroke victims. Can we talk a little bit about what that support includes?
Yeah, so on a case-by-case basis, people can apply to the Heart Fund if they have a family member who's suffered a stroke, just like a heart condition, and we assess their needs and see if we can be of assistance. We are looking at ways that we can support families in the long run, because it's a long path sometimes for a member of the family if they've had a stroke in rehabilitation. So we're looking at ways that we can have kind of a cardiac and stroke rehabilitation program where we can support people through that. And if just the family members need support and advice, because I think there's a lot of people out there that are probably caring for somebody that suffered a stroke, and that can be a great burden to them, even if they just need somebody to talk to or they need some counselling. We're here. So all of our contact details are on our website, on our social media pages. They can get in touch with us, and we're more than happy to assist.
And of course, there are people in the community who are probably listening to this wondering how they can help the Cayman Heart Fund. So tell us what you're in need of from the community.
Yeah, I mean, we obviously, we only exist as a charity through the donations from the members from the public. So we love people to support us, obviously financially if they can, but there's lots of ways that people can support us that isn't necessarily financial. One of the biggest ways is actually just following us on social. So not only do they, if you follow us on social, hear about all of our upcoming events. We do have a conference coming in early June, so it's just a month away, where we will be doing free health checks. But if people are supporting us on social, we're a stronger organisation, obviously, and that assists us when we're reaching out to organisations for financial and other support.
Mm-hmm. Very good. Some questions coming in. So one person has said, "Good morning, Sandy. Can you ask them if a parent has died from having a stroke after 7 days, what are the chances of me having a stroke?" So is there any sort of hereditary component to increased chance or increased risk of having a stroke?
There are genetic risk factors for strokes, but that would be in strokes which occur in younger people. So in general, we divided a stroke in young, which is generally 45 years and younger, where we would strongly suspect something genetic going on. But no, not all patients, because their parents have suffered a stroke, are at an increased risk of stroke. They need to follow the regular guidelines of controlling blood pressure, diabetes, exercising, alcohol intake, regulation, that kind of thing.
Yes. And Gina has a question. She says, so diagnosis of inappropriate sinus. Oh, is that tachycardia?
Tachycardia or POTS. No, I think what Dr. Susant was referring to is atrial fibrillation. It has nothing to do with sinus tachycardia or POTS. So atrial fibrillation is an irregular heartbeat which patients have, which predisposes them to form clots within the heart. These clots can then embolize, causing strokes. So it's not to do with POTS, no.
Okay, very good. Thanks for the clarification. Another listener to the program says, does Health City test for, is it ApoB size and quantity regarding cholesterol?
Yeah, we do that. We do an extended lipid profile. I think it means apolipoprotein. Yes. So we do those tests.
Yes. Okay. All right, folks. Again, we're speaking with Health City this morning, learning all about strokes. We're going to talk to Shamari here now as well, because of course we know that Health City is always keen to make sure that they're ahead of the game when it comes to anything that has to do with the world of healthcare. So Shamari, this approach has really put you guys, I think, in an excellent position in the Cayman Islands, in the local community, to really, just assist people from a knowledge-based perspective, from treatment, and getting the assistance that they need. So talk about why Health City has taken this approach.
No, definitely. As we all know, especially from a medical perspective, disease is ever evolving, as well as why we're here in the Cayman Islands. We want to make sure that we have all of the adequate equipment, all of the newest technology to make sure that we're doing the best job possible to give the highest quality of outcomes. But outside of the equipment, outside of the protocols, the most important components will be the human resources, the actual medical professionals who are diagnosing, who are having those collaborative types of efforts to make sure that we understand exactly what's wrong with our patients to be able to get them treatment. So, yes, we'll be having the newest and latest equipment, which you always hear us talking about from week to week. But what's more important is the Dr. Romnishes that we have, the Dr. Susants that we're bringing in to make sure that our people in the Cayman Islands are getting the best services possible. We talk about world-class healthcare, so you can't have world-class healthcare without constant research, without constantly increasing and bringing in new equipment and new techniques that are the latest and just based on the evidence in regards to giving the best outcomes. And with that, also bringing in the physicians to make sure that everything goes well as the nursing staff, ICU. It's that holistic care that gives us the highest quality of outcomes that we've become known for, not only in the Cayman Islands, but across the Caribbean, Latin America, and the Americas as well.
Okay, we've got Mr. Dean tuned in this morning. We've got a Mrs. Dean Sinclair and a Mr. Dean Gillette, both listening. So Miss Dean says, good morning, Sandy and CMR family. Missed my morning show yesterday. Yes, yesterday was a public holiday, folks, so we take the day off, but we're back in the hot seat today. And Mr. Dean says, is drinking wine better than hard liquor when it comes to stroke? So this is a good question, I think, just in terms of not just strokes, but your general health. Does it matter what type of alcohol you're drinking? Are there some that are worse for you than others?
Susant?
Actually, it's not really. It's the amount of alcohol that you are having. And if you're binging on alcohol, that is really bad. And that is a bigger risk factors. So the kind of alcohol, maybe it wine or scotch or beer, it's not really, doesn't really matter. But it's the pattern that of drinking that you follow. If you're drinking a few drinks a day and reducing it a few times a week, that is fine. But if you're binging in alcohol, that can really lead to a lot of problem. Even that can lead to cardiac arrhythmias, setting of cardiac arrhythmias, and resulting in stroke. So binge drinking is primarily the culprit here, and the amount of alcohol that you're taking is the culprit here.
And it's so interesting that you mentioned that, because again, a situation right here in the Cayman Islands, I mean, we have cases of people dying relatively young who drank a lot. And I remember an instance of one young man, people like, oh, it was always hard liquor that he was drinking. So I'm glad that you clarified that probably even if he was drinking wine, but drinking it to the extent that he enjoyed having a drink, it would not have really made a difference. Yeah. All right. Miss Gina has another question. She says, apart from all the technology and latest medical treatment, is there a discussion in nutrition and natural therapies to prevent these illnesses in the first place as much as is possible? So Shamari, talk a little bit about the other, and I guess that's why education is important, because, they say that an ounce of prevention is better than a pound of cure. So really trying to offset, disease, and trying to offset strokes and heart attacks, so that we don't necessarily need to see Dr. Susant or Dr. Romnish, is really why we educate people on this program as well, right?
Oh, definitely. And that's why even when you come in for your executive health check, we're always giving keys in regards to the right nutrition, the right diet, the right lifestyle. And, just like Dr. Romnish will give you the easy to remember, no more than 4 regular drinks in a setting, no more than 10 in a week. It's the same way that they'll speak about, the fist in regards to how much carbohydrates you should have in your actual plate, and what a true portion actually looks like. Just some common sense types of scenarios where you can easily remember it to get on that healthy lifestyle. Because if you try and do everything under the sun, then that means you'll do nothing. So we just try and make sure in incremental steps, if you're actually doing the right things, then that will make you as healthy as possible, give you a better probability of staying healthier. As we all know, nothing is 100%. But at Health City, that's why we have the holistic view, whereby we have other arms of Health City to be able to help persons to be able to have their healthiest lifestyle, to try and keep away from some of these diseases that will eventually come, especially as we get older. At some point in time, there will be some disease that we will get. I remember many years ago, going with my grandfather for one of his checkups, and at that time he must have been 80, 81, 82. And when the doctor told me the disease that he then had, he could see that I was upset, and he said, don't be upset. Here's how we're going to take care of it. And he's like, he's lived a long life, and trust me, when you reach this age, there will be something, right? Nobody lives forever. So that's something that we have to remember, that we're just going to try and do as much as possible to live as long as possible. And that's why you should always come in for your executive health checks. You can book with our nutritionists outside of the health checks, just to make sure that we're taking care of ourselves as best as possible.
Yes. And I must say, Gina, from personal experience, knowledge is power. So when you know your numbers, and you have an idea of what risk factors you have, you can then take action to try to mitigate and at least delay the onset of some of these things, if not prevent it entirely with some lifestyle changes. So, of course, Mr. Good Look, speaking of lifestyle, had to bring this topic up. This is my Achilles heel. If you know one thing about me, I do not drink and I do not smoke, but oh my God, the Pepsi. You know what I've done in my brain now is I've put Pepsi in the same category health-wise as alcohol. There is no such thing as a safe amount of Pepsi, but every once in a while I might indulge. So I had one like yesterday, and then I won't have any for the rest of the week. But the sodas in general, doctors, Mr. Good Look is asking, does that increase your chances of having a stroke? Well, it certainly increases your chance of diabetes, and diabetes increases your chances of having a stroke. So the short answer is probably yes.
Yes, exactly. It again comes down to controlling your sugar, your weight, because Pepsis can lead to weight gain as well. So.
Yeah. Oh.
And Dr. Ramnish, I don't know if it's Dr. Archita that had that interesting diagram where it was actually showing like the can of soda and the cubes of sugar that's actually in the soda. And if you have 3 sodas, it's like a pyramid of those cubes of sugar that you really don't understand. You think it's a liquid that you're drinking and ingesting. But when you actually see it in that context, that you realize that if you have 1 or 2 cans of soda a day, how much sugar you're actually intaking. I think that does the trick to get your mind to realize that you need to stay away from them.
Yeah, unfortunately, there's no good one out there, to be honest. And there's some that are actually worse than others. I mean, it's shocking, but the best bet is water. Water has none. So stick with water, and teas, of course, are also a really good alternative for you. And we're going to be talking more about nutrition on this program. I know that we touched, last week? Gosh, the time's just flying. We had some guests on the program talking about what they've done to bring down their weight. But we're going to talk more in the coming weeks. I think we just need to make this a regular feature in the program, where we talk about how we can tweak our diets. I had someone just last week say to me, Sandy, people are listening, people are paying attention, because they were out at dinner. I can't remember if it was Casanova's, but somewhere they saw some individuals, and they were out at dinner, and they overheard this other table say, "Oh, on Sandy's show, she said, I don't think it was Casanova, because it was orange juice, but she's like, oh, Sandy said don't have orange juice because that's also loaded with sugar." So they ended up having apple juice. And I thought to myself, ooh, they missed the point about juices in general. So it's not just orange juice that, I gave orange juice as an example, but all juices loaded with sugar. If you can't squeeze it and have it as a fresh juice, which really the best way to consume it is just to eat the apple, eat the orange, get your fiber, as well as the protection from the fruit, as opposed to drinking it. But any juice that you're going to pick up elsewhere, unless it's hand squeeze, fresh squeeze, is the problem. So it doesn't matter if it's apple juice, orange juice, whatever other juices are out there, try to stay away from those as much as possible. Everton has an excellent question about diet sodas, because some people actually think that a diet soda is better for you. But Everton, I can tell you the research does not support that position at all. Doctors, what's the current situation with diet soda? Sorry.
Sushant?
Actually, the chemical sweetener they use has been implicated in a lot of medical disorders. So it is actually not advisable to have diet soda. It's not something which can, as a preference, or like you can say that, oh, this is good, and we can have it rather than having a normal soda. So the chemicals used have been implicated, and it would be again advisable to take diet soda. I would rather prefer a normal soda once in a while rather than a diet soda.
Yep. All right. Denny's sharing a link for everyone to read about core resource on alcohol. So thank you, Denny. Strong Will says, good morning, Sandy. Hope all is well. I have a terrible stomach problem. Can you ask the doctors who can I see about my stomach? I need to see a good specialist. So this sounds like an internal medicine or gastrointestinal issue, perhaps. Who could he come in or make an appointment to see?
Dr. Sunil, I think Dr. Sunil or Dr. Cyril would be the best to start with. And then they would decide if he needs any other doctor to have a look at him.
All right, so start there. Give us the contact details again, Shamari. Maybe next week we need to go over the app to show people how to use the app, because I think that would be fantastic. But in the meantime, they can contact you by phone or email.
That's right, 640-4040 or info@healthcity.ky. And just exactly what he would have said, you put that in the email and we'll make sure the right patient care rep reaches out to get that appointment for him, or you can call and we'll do the same. So either way, we'll be able to get him to see the right physician.
All right, Miss First Lady Jan says she is sticking to water. That is your best bet. Vicky says when someone is grinding their, I think there's a word missing there. Is it teeth?
Most likely.
Not sure, but most likely. Is that a sign of a stroke? Well, that can be TMJ. That could be a number of different things, right?
So stroke would be something acute. It would be sudden. So someone has been grinding their teeth for a while, as you said, it's probably TMJ or something else. But it should be something new and acute, which has happened.
Okay. So in other words, something you've not had before and the onset, it's
sudden.
Yeah. Miss Iva, good morning. She says she's late for class, but she's here. Paul says, what about zero sugar sodas? There's still artificial sweeteners in those?
Exactly, yes.
Yeah, they try to trick us with all this fancy, marketing and terminology. Everton says, my primary care doctor that I've been with for years referred me to drink the diet soda and regular soda, some loss, because you're saying it's not good. And my doctor says, drink diet soda. Well, Everton, listen, you can do the research on your own, but I'm telling you, even the research that I've done for years now, the general idea is that diet soda is actually associated with weight gain, believe it or not, and other things. It's just not good for you. I'll send you a link here from Penn Medicine that you can, the truth about diet soda. Have a look at this, but there's tons of resources out there. And, Everton, this is where I think it gets a little bit confusing sometimes for people, because they'll say, oh, well, one research study said this, or one physician is telling me this. And not all physicians, I think this is worth noting, not all physicians keep up as much as they should with, the latest of all the medical and research papers and so on. And that's one of the things that I love about the folks over at Health City is they're actually, they're writing research papers involved. They're, clinicians, they're dealing with patients in a real way. So I think that, you can certainly accept their advice, but also go and do a little bit of research on your own. Alejandro says sodas and energy drinks are my thing. Time to give them up, honey chill. All right, so talk a little bit, Shamari, about the executive health check, and we also have a Mother's Day special. If we can bring that up to bring everyone up to speed on what those are as well.
No, definitely. So to start with the fact that appointments must be booked by May 14th. So get ready for Mother's Day, $150, and you can get your gift certificate for a mammogram for your mother, for your sister, for your daughter, if she's obviously of age, and we'll have the appointment scheduled prior to May 31st. If you need a little bit extra time, we'll definitely give you that to come in. But we want to make sure that those that actually get the that purchase the mammograms can come as soon as possible so that we don't forget. So that's part of our Mother's Day special, giving back to the community, $150, and you can come and get your mammograms. And as always, with the executive health check, definitely give us a call if you want to come in. We had a promotion for our year 9 of being in existence in the Cayman Islands that has since subsided. However, for affordable prices, mostly within your wellness check benefits, for the most part, you would be able to afford the executive health check to come in and get that as well. You should have, if you haven't had it, you should have it at least once a year, and then after you have it, then your physician will let you know the increments depending on your numbers of when you should come back. So as always, Sandy, looking to give back to the community, get as many screenings as possible. We're in the community within different districts, working through charitable organizations as well as churches to have as many screenings as possible for free across the various cancer disease profiles to make sure that we're, one, making sure that people are healthy, but two, if we do catch something, we're trying to catch it at the early stages, because if we catch cancers within stage 1, for the most part, your 95% probability of living for the 5-year mark, which is the first indicator of success when it comes to cancer.
Wonderful. Now, Sarah is asking about the executive health check. Now, I do know that throughout the year you have specials on those. Do you have any specials coming up?
Well, we already are priced pretty affordably. So $6.99 US is for the basic package, and then if you want add-ons and such, we can give you those add-ons as well. But the basic package is $6.99 US.
Yes, and Sarah, I can tell you from personal experience, you're going to get prodded and probed in every way, but you're going to walk around with a comprehensive package, knowing all of your numbers. I did a couple add-on packages, including the women's package. And, I'm glad that I did, because it really told me where I need to, have a look at some stuff. Now, she's saying that $6.99 is not affordable. Of course, your insurance will cover some of that as far as wellness, and if you haven't used up any of your wellness.
And just to give you an example, the type of package that we're offering for $6.99 would be $3,000 or higher in like institutions in the US as an example.
That sounds affordable by comparison. Yes. All right. So Erica says energy drinks are just as bad as sodas as they increase the heart rate. Correct me if I'm wrong. So is there any real benefit to drinking energy drinks?
No, absolutely not. It's again because of the caffeine in the energy drinks, which causes the heart rate to go up. So as you said, Sandra, water is the best.
Yep. Okay. Everton has another question about eating ice cream. Oh my gosh, Everton, don't we all love a nice bowl of ice cream? But I think everything in moderation, right? So no one's saying that you can never eat ice cream ever again. But if you're eating ice cream with every meal, or ice cream 3-4 times a week, that's probably an overindulgence. So it's really a matter of cutting back on the things that are not really good for you. Nobody's going to tell you that ice cream is good for you, Everton. But, a little bit here and there, you'll be all right.
Yeah. And depends on the numbers. If you're diabetic, not diabetic.
Yes. Yeah. Because you want to be more careful if you already have pre-existing conditions. Well, thank you so much for coming on the program. We really appreciate having you guys here today. Dr. Suat, this is your first time again. Welcome to the Cayman Islands. And of course, welcome to Cayman Mall Road. It's such a pleasure having you in the program. And as always, Dr. Ramneesh, it's good to see you again. Ali, thank you. And Shamari, thank you so much for putting this amazing program together every single week. You and your entire team really do a fantastic job.
Thank you, Sandy, and thank you for having us. And it really makes us feel good when we are missing, and whether it's a public holiday Monday, and if we're not able to get here Tuesday, that anybody, you go to the grocery store, they're saying, where are you? Why were you not on? What's going on? We need to hear, when is medical rundown coming back on? So that really tells us that people enjoy it and people are finding it useful. And if through this messaging we can even save one life or have a better quality of life for a few people, then we've definitely achieved our goal.
Absolutely. Thank you so much again. All right, folks. Really tickled pink. Every single Tuesday we have Medical Rundown Tuesdays here with Health City. We appreciate